Hey there, I am Trish, labor nurse mama, and you can find me on Instagram. I'd love to have you follow me for some education. I wanted to go over this post about 7 common labor medications and just tell you a little bit more in depth. Or you can read the post, and if you have any questions, make sure that you comment and tell me what you think. So of course, I'm gonna start with Pitocin. I can't talk, which is the man-made version of oxytocin, which is what our body makes so perfectly. Pitocin is the big gun in labor and delivery. We use it way too much. I will just say that. As you guys all know, I am the labor nurse who loves natural birth and limited interventions. So back to Pitocin. So Pitocin is what we use to induce you, but we also use it after birth for prevention of hemorrhages, or if you are hemorrhaging, we'll use Pitocin. So Pitocin is used to induce by giving you I say little sniffs. So we started out very low. So for instance, if you have an IV that's giving you IV fluids, you're going to be getting about 125 milliliters per hour. With Pitocin, we start out with milliunits, which is usually about the same as a milliliter. So we start, let's say, with 1 to 2 milliliters per hour, and we might increase every 30 minutes until we get you into a nice pattern. But let me tell you, the studies have shown that going low and going slow is the way to get you into a good labor pattern. For many years, the trend was to push it hard, push it hard, push it hard. And they're learning now that it just takes a little bit and it takes a low amount of it. And once you're in a good pattern and your body takes over, I always tell my patients, you'll know when your body takes over. When your body takes over and it's not Pitocin contractions, your body just does an effective job. So we have 2 medications that we use to soften your cervix. If your cervix is not soft and you come in for an induction, you're probably going to get one of these 2 before we ever start you on Pitocin. So if you have been scheduled for an induction and you're going in at night, chances are you're going to be started with Cytotec or Cervidil. Cytotec is a pill form that we use, and it's a very strong medication. We cut it in 4s usually, and some hospitals give it to you by mouth, and some hospitals we put it in the vagina. We also use it after delivery for hemorrhages, and it will go in your bottom. Sorry to tell you that. Cervidil is another medication we use to soften your cervix, to get it nice and ready to start that Pitocin and to get you into labor. Cervidil, I always refer to it as a flat tampon. So it's a little white, flat piece of, it looks like cloth or gauze. It's about that long, maybe that wide, and very, very thin, and it's got a long string just like a tampon. And what we do is we put that into your Lord have mercy, we do not do either of those things. We put it into your vagina and we guide it up as close as we can to your cervix. It's not very comfortable when we do it because we can't use any gel, so it's really aggravating and difficult. I recommend that you do nice deep breathing and relax your legs and your pelvis as much as possible. And you have to lay flat, and with both of those medications in the vagina, there's a period where you have to stay in bed. The good thing about Cervidil is if you get into a bad pattern or your baby's not doing well, we can just pull it out. With the Cytotec, once it's in, it dissolves. So it's a little more risky. The other thing that we use commonly in labor and delivery is antibiotics. You'll get antibiotics if you're GBS positive. We swab your, or your doctor's office will swab your bottom from the vagina to the anus and tell if you are GBS positive, group B strep positive. And you're going to, if you are, then chances are very high that you're going to get antibiotics in the hospital before delivery. The other time we might use antibiotics is if you develop a fever during labor. And sometimes that means that your amniotic fluid might be infected. The other time we use it is before a C-section. As far as pain relief, we've got 2 different options, the epidural or IV pain medications. I'll tell you the truth about the IV pain medications is they usually work amazing the first time we give it, but subsequently not so much. So if you're deciding to get an epidural, I always say don't do the IV medications, go straight for the big gun, which is the epidural. One thing I want to tell you about an epidural, a lot of people get confused and they ask me, is it going to wear off before I start pushing? No, it doesn't work like that. So the CRNA or the anesthesiologist will come in, they insert a very, very thin flexible catheter and into your back, and the medicine is pumped from a pump in very small increments all the way through until someone turns it off, which is usually me, the labor nurse. I turn it off after you've delivered almost immediately. I turn it off so that your legs will start, so you can start moving your legs and start feeling again and be able to get up and go to the bathroom. And once you get up and go to the bathroom, you can go on to postpartum. So the other is the IV medications. We do Stadol, fentanyl, and Nubain, and some hospitals fluctuate. There are other ones that use, but those are usually the ones. The other thing about IV medication is if it's given too soon before delivery or too close to delivery, there's a high chance your baby will have to go to the nursery because it affects their respiratory system. Another thing that's used is nitrous oxide. I have personally not used nitrous oxide. I've been at a lot of facilities as a travel labor and delivery nurse and as a staff nurse, and none of the places that I've worked have used it. But what's really cool about it is that it's patient controlled. So you're going to have your tank and you're going to have your mask, and you only use it during your contraction. So you breathe it in and it relaxes you. And I've heard it's amazing, that it works amazing. As soon as your contraction's over, it's out of your system, it's gone. It also doesn't affect the fetal respiratory, the fetal awareness, or any of that. So that's that for the most popular and the most common medications that we use in labor and delivery. I'd love to hear your questions or your experiences. Again, there are other medications that are used for high-risk pregnancies, but for a normal labor, which 9 times out of 10, a lot of women get induced. So these are the normal medications, and you can download this and take this with you to the hospital. So when your nurse comes in and hopefully she gives you an adequate explanation of what you're getting, but if not, you'll have your own little reference. And again, I'd love to hear your comments.